Coming back to World AIDS Day, now Right to Care is rolling out a program to educate healthcare workers about the LGBTI community. The program is focused on ensuring LGBTI individuals feel safe, unjudged and fully accepted in clinics and facilities. It trains healthcare professionals to eliminate any personal negative sentiments towards LGBTI patients. Now, the program empowers them to ask the right questions of LGBTI patients so shame-free answers can be given and the right action can be taken. Now, to tell us more about the program, we are joined in studio by Craig Chapman from Right to Care. A very good morning and thank you for being here.
Thank you for having me and good morning to your listeners.
Of course, this is a very important day. And
yes.
How important or how significant is World AIDS Day for the LGBTI community?
It's very important. The LGBTI community and the key populations as a whole are perceived to carry a much higher burden of the HIV virus. And acceptance and tolerance is enshrined in our Constitution, but it doesn't always translate into good practice in our services, especially regarding the LGBTI community, the lesbian, the gay, the bisexual, transgender, and intersex community in our healthcare systems and other government services. And so the aim is to make sure that they are sensitized to ask the right questions. And by asking the right questions, they can then ensure that the LGBTI communities, A, come back to the clinics, and B, access the services. And there are three main problems. The first one is the messaging. When you go into a clinic as an LGBTI person, you are surrounded by posters that portray a husband and a wife and a child, but there are very seldom any LGBTI posters in any clinic in South Africa. So we need to change that. We've been very successful in our messaging to fighting HIV with the prevention of mother-to-child transmission, and we need to translate that into other communities. And the second is then to get the healthcare workers to ask the right question. Don't just say to your client, are you having sex? That's a closed, the client's going to say yes, and that's the end of the discussion. Ask your client, what kind of sex are you having? Is it anal penetrative? Is it vaginal receptive? Because that's going to impact on the treatment that you are given. So they must ask the question.
Now, these can, perhaps for someone who's not familiar with the LGBTI community, these questions can be uncomfortable
Absolutely.
to ask.
No one wants to talk about anal sex. It's the big taboo.
So how do we sensitize and educate our healthcare workers, not just in the private, but also the public sector, especially the smaller clinics in the rural areas? How do we get this message
Right to
across?
Care has initiated, firstly within Right to Care, a program, an initiative called Right to Pride. And we started with our own staff, because we have over 2,000 staff, and we realized that we get a lot of staff from different communities and different sexual practices, so that we sensitized our staff how to interact with the LGBTI community. And it's paid off wonderfully, because the LGBTI community within Right to Care starts to feel safer, more empowered, and the other staff now know how to address each other. For example, when a trans woman comes to a clinic and she's carrying the wrong identity document because the Department of Home Affairs hasn't changed her identity document yet. And so the nurse looks and says, John Smith, and looks at the client and says, sir, why are you here? For a trans woman, that's a huge insult. They need to ask the question, how would you like to be addressed? And that will immediately send a message to your LGBTI community, I'm accepted. I'm recognized. I can come back here. I can access this treatment. And if I access my treatment, the 1990 goal that we all aspire to is going to become much more of a reality than we think.
Now, I know the LGBTI community has been calling for certain or specialized clinics specifically for the LGBTI community. How is this going? Do we have any of these clinics as yet? And
we do.
Do we have are we going to see a growth in this from the
We do,
next
but
year?
they're funded by Sir Elton John's foundation. And so in order to cover the entire country, it's far more cost effective for us to sensitize the staff that we have working within the clinics that we have than to try and build more clinics specifically for LGBTI communities. They're great if they can be funded. But you know, what do we want as an LGBTI community? We want acceptance. I don't want your tolerance. We want acceptance. And we're entitled to that acceptance under the Constitution, and we're entitled to the services under that Constitution.
Now, one of the problems you mentioned was identity documents. Is Right to Care working with the Home Affairs Department in this regard?
We haven't started yet, but we are going to. We're going to roll out a program starting next year, and once we get the cascade effect of rolling out and getting staff to understand that their job is absolutely imperative to the success of fighting HIV, so that it's all interconnected. We have to stop thinking of sex and HIV in silos. We're not the heterosexual community over here and the LGBTI community over there. It's all connected.
Now, this silo that you're talking about, it seems to be hampering efforts to curb HIV.
Yes.
How do we get past this? And just can you explain this term silo thinking?
Well, people think that if you have a husband and a wife and they're having sex and there's no one else in the relationship, the wife doesn't know that the husband has a boyfriend, or the husband doesn't know that the wife has a girlfriend. There's already a crossover. So it does impact. Have the conversation. Talk to each other. You know, we need to think of HIV as a felt fire. And the fire is burning. We talk about all the time of the youth and the young women as very impacted by HIV. Yes, they are. But let's think about this felt fire for a minute and think of the resources, the donor money, as the water fighting the fire. The water is running out. But with any fire, if you don't put out the whole fire, it can flare up again. So by ignoring the LGBTI community and concentrating only on the young women, we are doing our country and ourselves a huge disservice.
Well, thank you very much for joining us.
Thank you very much.
Today.
Thank you so much.
That, of course, is Craig Chapman from Right to Care. Well, it seems that we are now going to take a break. We'll be right back.